The Mediterranean diet has long been celebrated as one of the most heart-healthy eating patterns in the world, emphasizing fruits, vegetables, whole grains, legumes, nuts, olive oil, moderate fish and poultry, and limited red meat or processed foods. Its benefits for cardiovascular health are well documented, including improved cholesterol profiles, reduced systemic inflammation, and lower incidence of heart disease. However, recent research has revealed a more nuanced picture. While the Mediterranean diet reliably supports heart health, its effects on other metabolic markers, such as weight, insulin sensitivity, and blood pressure, are less consistent. Understanding these mixed outcomes provides valuable insight into how this diet can be tailored for optimal overall health and highlights both its strengths and areas for strategic adjustment. Multiple studies demonstrate that the Mediterranean diet effectively improves lipid profiles, lowering LDL cholesterol, the so-called bad cholesterol, while increasing HDL cholesterol, which is protective for heart health. Olive oil, nuts, and fatty fish contribute beneficial monounsaturated and polyunsaturated fats, which support these improvements. Furthermore, the diet's abundant antioxidants, polyphenol, and fiber help reduce systemic inflammation, a key driver of cardiovascular disease. Reduced levels of inflammatory markers, such as C-reactive protein, have been consistently observed in participants adhering to Mediterranean eating patterns, suggesting that the diet actively promotes vascular health and overall resilience to heart disease. Despite these clear cardiovascular benefits, research indicates that the Mediterranean diet does not consistently produce improvements in all metabolic markers. Weight loss outcomes, for example, vary depending on caloric intake, individual metabolic status, and adherence. Some participants maintain or even gain modest weight if portions are not monitored, despite the nutrient-dense composition of the diet. Similarly, effects on insulin sensitivity are mixed. While some individuals experience improved blood glucose regulation, particularly when the diet is paired with increased physical activity or limited processed carbohydrate intake, others show little change. Blood pressure responses are also variable, influenced by baseline sodium intake, genetics, and lifestyle factors. These variations underscore the importance of personalized nutrition. The Mediterranean diet provides a strong foundation, but individual adjustments may be necessary to address specific metabolic goals. The positive perspective is that the Mediterranean diet's flexibility allows for targeted optimization. For example, emphasizing legumes, high-fiber whole grains, and non-starchy vegetables can enhance satiety and support weight management. Reducing refined carbohydrates and processed foods within the Mediterranean framework may further improve insulin sensitivity. Similarly, increasing intake of potassium-rich vegetables, fruits, and moderate dairy sources can complement naturally occurring healthy fats to support better blood pressure control. By leveraging the diet's inherent nutrient density and adaptability, individuals can maximize benefits across a broader range of metabolic markers while retaining the proven cardiovascular advantages. Another encouraging aspect of the Mediterranean diet is its synergy with lifestyle factors beyond food alone. Physical activity, adequate sleep, stress management, and social eating patterns, such as shared meals, enhance the diet's benefits and may help compensate for metabolic markers that show mixed outcomes in clinical studies. These holistic components amplify the diet's positive effects, improving insulin regulation, weight maintenance, and vascular function, while reinforcing the heart protective effects already inherent in its composition. In this way, the Mediterranean diet is not just a collection of foods, but a lifestyle template that fosters resilience across multiple dimensions of health. Even with mixed outcomes in some metabolic areas, the Mediterranean diet consistently demonstrates long-term benefits for cardiovascular mortality, quality of life, and chronic disease prevention. Its emphasis on nutrient-rich, minimally processed foods supports gut health, antioxidant defenses, and overall metabolic resilience. This suggests that short-term fluctuations in weight, insulin sensitivity, or blood pressure should not overshadow the substantial protective effects the diet offers over decades. In addition, the diet's positive impact on heart health may indirectly support other metabolic systems. Improved lipid profiles and reduced inflammation can enhance vascular function, reduce oxidative stress, and create a more favorable internal environment for long-term metabolic regulation. Ultimately, the emerging research reinforces the Mediterranean diet as a highly beneficial and adaptable eating pattern. Its proven strengths in improving cholesterol, reducing inflammation, and supporting cardiovascular health are clear and reproducible, while its variable effects on weight, insulin sensitivity, and blood pressure highlight the importance of individual tailoring. By combining the diet with mindful portion control, focused carbohydrate management, and lifestyle strategies such as exercise and stress reduction, individuals can achieve a more comprehensive metabolic benefit. Rather than viewing mixed outcomes as limitations, they represent opportunities for personalized optimization. The Mediterranean diet exemplifies a holistic, sustainable approach to nutrition, one that protects heart health, encourages nutrient diversity, and allows flexibility to address individual metabolic goals, ultimately fostering long-term wellness and resilience across multiple systems of the body.